by Channel 4, the local station. This is Look Local.
Welcome to Look Local. I'm Karen Adams. This is the place where we celebrate the best and the brightest of where we live and the distinct charm and character of Jacksonville. We do that by reminding you if you're looking for something to do or for someone to help, it is always better to look local. This week, we're taking a close look at Orange Park Medical Center. We're going to be talking to the director of the emergency room. Also, Granite Transformations will be along. We'll be speaking with Tony Davis. Plexiderm will be along as well. We'll be talking about how you can look 10 years younger without surgery. And finally, 904thin.com, we will be discussing the Nutrimost program. We begin with Dr. Stephen Goodfriend. Thank you so much for coming in. You're with Orange Park Medical Center, and a lot going on in the ER over there. Tell us a little bit about it.
Yeah, so we're starting up our trauma program. We've been functioning as a trauma center over the past year. And basically what we want to get out to the community is that functioning as a trauma center is a lot different versus functioning as just a standalone emergency department.
Okay.
As a trauma center, or as an emergency department, it's usually one physician, one patient, one nurse, giving that excellent care one patient at a time. When we have a trauma center, we're actually focused as a team in focusing on delivering the best possible care for the patient. We have a trauma team that consists of a trauma surgeon, anesthesiologist, emergency room physician, trauma nurses, and we're able to provide the best level of care for these patients that can be severely injured and that may need a lot of resources in a very short time frame. And with trauma, time is of the essence. So we need to dedicate a lot of resources in a very short time period for these patients.
So it's almost like it's more well equipped to handle emergencies on a larger scale, if you will.
It is on a larger scale, even one patient at a time too. If one patient comes in and that's a victim of trauma, they can have vast amount of injuries that they may need a tremendous amount of resources, may need to go to the operating room in a very short time. As a trauma center, it allows us to really function at a much higher level. We're also having the trauma center in place. It also elevates the care that we can provide for our medical patients, our non-trauma patients, and that allows us access to the operating room a lot faster, allows us access to more consultants if needed, and just provides a higher level of care and faster care.
Exactly. I think sometimes when people talk about trauma, they often think about maybe gunshot wounds or knife wounds, something like that. But you and I were speaking just before we went on, and more times than not, it's blunt trauma.
It is. Blunt trauma is the most common trauma that we see here in Florida. We do see the shootings and stabbings, but in general, most of it is blunt. Motor vehicle accidents being common, motorcycle accidents. Falls is probably the biggest area or most amount of patients we see that are victims of trauma. When we have an elderly population and patients that are on blood thinners, falls, even from a ground level, can have disastrous effects on patients and major morbidity and mortality.
What do you do in a situation like that when time is of the essence and they're on like some kind of blood thinner like Coumadin and you have to get that clotted? What happens in a situation like that?
Yeah, for those types of patients, the nice thing about being a trauma center is we have policies and procedures in place. So when those patients come in, the whole trauma team assembles, cares for this patient. We have rapid means of reversing and making their blood thick if we need to call a neurosurgeon. Getting a rapid CT scan is very important too. Versus non-trauma centers, it can be a little difficult to get all those resources going at the same time.
And there could be more of a wait, and as you're saying, that's what you don't want.
Right, time is of the essence. When you're dealing with trauma and severely injured patients, time is of the essence. They talk about the golden hour, which essentially an hour is the average of how fast you want to get a patient to a trauma center and get them definitive care.
Really? And that's the golden hour?
The golden hour.
So all between that time frame.
Correct.
Is when things can go south, I guess, if you don't make it by then. What else do you guys have going on? There's something with Cool Wheels?
Yeah, so we have an event coming up December 3rd. Cool Wheels is at the hospital. We have Clay County Fire Rescue. We have a towing company there. We're actually going to demonstrate how to extricate patients from a car. We're also going to do a safety evaluation of having adults, how they properly fit inside a car and wearing the seatbelt properly. That will be free of charge. We're going to have our helicopter services there, which will be available to tour for the community. So it'll be a good outreach. And the key thing that we want to do is really try and prevent trauma. Many times when trauma patients come in, we're thinking in our minds, you know, this obviously could be prevented. So our big goal is really community outreach and try minimizing the amount of trauma patients that we see.
Okay. Also with Christmas coming up, I know a lot of popular gifts out there, those hoverboards. I got to ask you, are those really a good idea or a bad idea for kids? I know all kids want them, and I hear a lot of things, doctors in emergency rooms.
You know, it's funny. My daughter asked me for a hoverboard, and we said no to her. So that's my best advice.
I said no to mine too. So I'm like, no, I don't want any part of that. You'll be in an emergency room. Any other final thoughts you'd like to pass along?
No, I think the key thing is just making the awareness that we're a trauma center, and you know, one of the things that I was thinking about before is just how big Jacksonville is. It's a huge area, huge city. You know, we have 1.5 million people that live in the area. You know, having one trauma center is not suffice for the population, and when we talk about the golden hour and getting patients to a trauma center in a timely manner. So I think just it's good. It's going to be very good for the community.
I think getting to the one that's the closest to you proximity-wise, and I think it's great that Orange Park Medical Center is equipped to handle anything that comes your way. Listen, thank you so much, Dr. Stephen Goodfriend, for coming in today.
Thank you.
Appreciate it. Up next, how to remodel your kitchen without a big hassle. Tony Davis will tell us how he makes that happen.